A chilling kidney sale racket uncovered in Namakkal has once again exposed the illegal organ trade in Tamil Nadu.
கிட்னி இப்போ 50,000 தரேன் வான்னு புரோவு சொன்னார்.
லோனு கட்ட முடியல, நீங்க கட்டியே ஆகணும்னு சொல்லும் போது என்ன பண்ணுவாங்க, அப்புறம் இப்படி சொன்னா அதை போய் அவங்க கிட்னி எடுக்கிறாங்க.
எங்களுக்கு அப்போ கொஞ்சம் பிரச்சனை, கடன் பிரச்சனை இருந்தது. அதனால நாங்கள் அந்த இதில் இது பண்ணோம்.
Two private hospitals, one in Trichy and another one in Namakkal, have come under the scanner for allegedly facilitating illegal transplants. Investigators have identified 6 victims so far, and there are fears that this racket could have expanded to other districts and states as well. The Tamil Nadu government has ordered a probe, and the health minister has vowed strict action against those involved. But the question remains, will this be enough to dismantle such deeply organized networks?
அதை விற்பனையாவோ இல்லை வியாபாரமாவோ ஆக்குவது என்பது கடுங்குற்றம்.
This scandal is not about illegal transplant. It is about a system that repeatedly fails to protect the lives of the poor. In this week's In Public Interest, I sat down with Dr Shanthi, National Secretary of Doctors Association for Social Equality, to try and understand why, despite such strict mechanisms in place, illegal organ trade continues to thrive in the state. Before I go any further, here is a quick reminder. In Public Interest is a new show on the News Minute where I, along with my colleagues from across South India, bring you stories that matter. Stories that are often ignored or underreported. If you want a particular story or an issue to be discussed, do write to us. Remember, this show is truly in your interest because you, the viewer, who is sponsoring it, not a political party or a corporate entity. If you want to support us, scan this QR code and become a paid subscriber of the News Minute, or click the link in the description to contribute to our reporting fund. Ma'am, thank you so much for talking to us. Why are we seeing these rackets coming up time and again?
So as you rightly mentioned, it has been unearthed now.
Yeah.
It has been there. Suddenly, the reason for this is they have been asked to promise to pay 5 lakhs, but it was not paid. One person is telling, I have been paid only 4.5 lakh when I was promised to 5. Another person is telling, I have been paid only 1 lakh, like that. So it's a contract between one person to another person. When there is a deviation in the contract, then only they are coming out. It shows that this problem is there, is for a long time, everywhere, including Tamil Nadu, and it is there more than 2-3 decades, because this transplant technique, the transferring one organ from, harvesting one organ from one person and it is getting transplanted to another person, is there for since few decades, and from that time onwards it is there. The main reason for that is who will be ready to give their organ, who will be ready to sell or donate their organ. We can say that it is donation, or it will be written as donation, it will be shown as a donation, but obviously they are selling their organ. What made them to sell their organ? Nobody wants to sell their organ. And moreover, it's not easy, it's not just giving one ornament. It is, they have to undergo a painful process, they have to undergo surgery. They have to undergo an operation and anesthesia. And after surgery also there will be some consequence, so they have to undergo all these things. But still, what makes them to do that? It is because of their poverty, unemployment, underpayment, all these things. See, in 2004 tsunami time also, same thing happened. In the fishermen folk, they were severely affected by a lack of profession, lack of money, lack of job, and then so many people they have started donating, and it was that time a big racket. So that happened 20 years before, and even now it is happening. Now there are so many other issues, MSMEs are getting affected, and these people, one side there is a need. There is a lot of non-communicable diseases are increasing, diabetes increasing, hypertension increasing, which affects the organ, the end organ, that is kidney. So kidney failure happens. So you can do dialysis. After some time, the permanent solution is to undergo transplant. So who will give a kidney? So for rich people, they don't even ask for their spouse or their relatives. They'll come to the hospital, corporate hospital, they'll say, I'm ready to pay any amount. Get me the donor, get me a person. So there is a hospital, there is a broker, there is an agent, you can call it by any name, and these people will identify the donor. So who will be the donor? The person who is really affected, desperate for money, and that person will be giving, whether it is intentionally, whether it is the full heart or not, they are forced to give. So what they will identify the people who are at severe debt trap, and then they will go to the microfinancing agency or some private person, those who are giving loans, the jewel loan or something or like, and even ration card, Aadhaar card, everything is kept as for a loan. And so they'll be threatened. You have to give money, otherwise we'll take away your house property. Even they are threatened that their family women will be exploited. You have to send your wife or daughter to me, like that. So such kind of threat is coming from the finance people. And so they are, when the broker approaches, when an agent approaches, why don't you give a kidney? It's not a very tough nowadays. You can go and come back in 5 days or so. It's like that. They will say, okay, why don't you try like that? So they are giving, and one person will tell this to his friend. Okay, I went like that. Say I could do my daughter's marriage, or I can shell out this money to repay my loan, like that. So it's like that. It's a chain of things.
It's like a chain.
It's like a chain. And so it is easy for an agent to catch one person, and then even in this case, I told my aunt has given, so she told me that I like that. So it is a chain, it is going, it's very easy. And then it's very easy to cheat them also, because it may be a contract, it's an oral contract, nothing is written there. So nobody can say that when you assured me, you promised me that you will pay 5 lakhs. No, and you cannot, after removing the kidney, you cannot ask, because there is no written document. And that is the plus point for the agents, that is a plus point for the brokers, and they take all the money. And then the person, the patient, who is most probably, most of the time the rich person, they are paying more. And they don't have any guilty feeling, because I am paying, that's why. But it is just getting segregated step by step. And when it comes to donor, it's a very meager amount only they are getting it. And that also they are exploited, because they are losing the target. But middleman only, they are just getting money, like earning like this. And you can even remember another case in Erode, what happened last year, the oocyte donation from a young girl. The family members of the girl, they themselves forced her to donate that ovum for too many times, in too many different places. And then Aadhaar card was prepared in different names in different places. And so many forgeries documents were being created in coordination, in acceptance with the family members. And then this whole thing came out, and even the hospitals were closed for time being, and the action being taken. So these kind of issues are there.
Okay, this cannot happen without the support of hospital,
Yeah.
the role of hospital. What
Yeah.
is the role of these hospitals, private hospitals?
Yeah, there is a Transplant of Human Organ and Tissue Act is there, 1994. That act has been now and then it is getting changed. And that got some rules and regulations, it just strengthens. But if you want to cheat, you can cheat anybody. See, the person say, if I come to oocyte, so one person can give oocyte for only once with one Aadhaar card. When they are creating another Aadhaar card, and that is being done in another place, see, that hospital is not aware that this patient is coming here for the 3rd time to give OVA. Kidney means it is not there, so they can easily find out. So they are going from one place to another place, and that is why that is possible. Coming to kidney, this racket is also, we can, even in this case, the beneficiaries are from different states, Andhra, Telangana, Karnataka. They are coming here to Chennai, Tamil Nadu, as a part of medical tourism, as we have a very good quality treatment here in private setup. And that is why they are coming. And here we have problems now, the severe unemployment, the closure of the small and medium-sized industries, handloom industries, textile industries, dye industry, and that is why it is coming mainly in those areas.
And also the role of doctors, ma'am, like we have spoken about the role of hospitals.
Yeah.
Because there are several private...
So coming to hospital, it can be done intentionally, unintentionally also. Knowingly also they can do, they can have, see, we have patients, we have pressure, and we cannot just lose the patient who have come over all the way from there for organ transplantation. It's just a big amount. And then if a person is coming from Telangana, with a success story of getting discharged with a kidney transplanted, he will go and tell another patient there. So another person will come in Telangana to the same hospital. So for the development of hospital, the hospitals are also involved in this kind of system with the brokers and middlemen to get donors. But sometimes it may happen even unintentionally also. That's also theoretical possibility, and that is also happening. Coming to doctors.
Doctors, yeah.
Doctors are they are technical people. This act has got so many things, and there are so many people involved in this in verifying. Even in this suicide case in the Nehru, what we say, the age of the girl is only 30, but the report, the other document says 23. You can easily find out whether the girl is 13 or 23. So there we could identify the role of doctors, that is involvement of doctors. But on contrary, if the age is 21 or 18, there is a minor difference, it's very difficult to find out. And moreover, checking the Aadhaar, whether there is a duplication or not, all those technical details are not possible by the doctors. And so that is why there are different mechanisms are there. That is in Artificial Reproductive Technology Act and Surrogacy Act and all, now only the act has come, there are some regulations like that. There in organ transplant also there are some regulations, but there are some loopholes also. And using that loopholes, creating this duplicated document, Aadhaar number, this, that, they are giving. And there is a clear-cut consent. I am giving voluntarily, I am not being forced, I am not selling. Like that, there are so many words. Obviously, the people who are signing, they don't even know what is written there.
Talking about the role of doctors, there are some reports, some information that the surgeons are ready to do these surgeries for a meager amount of 25,000 or 50,000. So, doing these kind of surgeries in areas like Namakkal, Erode, Tirupur, Karur, it's all very easy. So, what is the monitoring mechanism to ensure that these kind of illegal things do not happen, illegal surgeries do not happen?
We have Transplant Authority of Tamil Nadu, and there is a website. You can simply go through it. Everything is given clearly. Like that, we have NOTA, that is National Organ Transplant. And there are websites, and that website clearly says which are all the hospitals who got license to do transplant. And those things are there, and what is the mechanism, who can donate, who cannot donate, what is the procedure, what's the consent, what should not be done, do's, don'ts, everything are given there. It's even given by the other Ministry of Health website also. But the person who is donating is most of the time they are not educated, they are very poor, they are from a very poor background, from the low caste, all these things. So they don't have that access to the website. And they don't know all these things. They are in need of money, desperately in need of money in a very short time. Whatever is available for them. So they don't, even though there is lot of mechanisms, lot of checklists, lot of information available, but it is not possible for the donor to get into those information. And even if it is this, the brokers and agents will say nothing will happen. Just see, so many people have undergone, they have undergone nothing. You will get money immediately, do this immediately, I'll give like that, they will give false promises. And so they are just becoming a prey for those things. And even though the enough scientific, technical knowledge, informations are available in the websites, the donors are not going to get because they belong to a poor people, and they are most of the time uneducated.
But the question is about regulation. When there are hospitals that are involved, when there are doctors that are involved.
Yeah, there is an inspection authority.
What is the monitoring mechanism? What is the, yes.
Yeah, inspection authority should come regularly. They have to scrutinize, do the scrutinization of the all thing. At least they can do it at random also, no? See, even in this case, it is happening in 2-3 hospitals, nearer. And then what is the mechanism, checking mechanism, that inspection authorities, what they are doing? They are not doing anything. That's the problem.
Now, who are these inspection authorities?
That's also state government authorities and central government authorities.
What is their role?
Their role is just there are only selected hospital with a license to do transplant surgery. You may have 1 lakh hospitals in the country, in the state, but all the hospitals are not doing transplant surgery. All the hospitals are not having the facility or experts, doctors, specialist doctor. So there are very handful of hospitals in Tamil Nadu, in Chennai are doing this transplant surgery. So what prevents the authorities to go and verify it? To check all these things, whether the donor is a real donor, they can even randomly call, they can even call everybody and find a seat, whether it is a relative donor or under force or something of that kind. Obviously, you can see the background of the person also. What happens, why he is donating, when it happened, like that and all, how the money was distributed, whether the money was distributed or not, whether their post-operative care was given, after that whether their insurance is given. Some mechanism should be there for them to get treatment after surgery also. No, there are 2 aspects. One is exploitation of the economical exploitation, then health-wise there is exploitation, cheating, everything is there, no? So everything should be taken care. So how can you prevent this? One mechanism is the existing inspection mechanism, regulatory mechanism should work. And it is not working.
now-
And it's not tough also. It's not tough because it is not lakhs and lakhs of surgeries are not done. It is very limited surgeries, very limited handful of surgeries only is going on. And so it is very easy. And another thing is, why most of the surgeries are being done in a private setup? Why don't you have?
That's the question. Like, who monitors them?
No, it is not the question of monitoring. The government is not taking initiative to do transplant surgeries in all government hospitals. We have 35 medical colleges. Do we have transplant surgery facility in all medical colleges? No. In India, Tamil Nadu is the only state where we have super specialists. We have MCH cardiac surgeon, and then a neurosurgeon, and then neurologist. We are just producing maximum number of super specialists who have to be there to do this kind of surgery. There is no shortage of manpower, which is there in other state. We have enough manpower, and we have enough infrastructure. We have medical college, we have operation theatre. What else you want? What is the requirement is you need to implement this kind of transplantation facility in all medical colleges. That should spread all over Tamil Nadu. But that mechanism is not there. The Madras Medical College, Stanley Medical College, they are just doing surgeries. But what about the other peripheries? What about other colleges? Even starting the multi-speciality hospital, now they have started in Guindy. Already there one in Omandura, which is also in Chennai. Is there any multi-speciality hospital in southern part of Tamil Nadu? For any kidney problem, any failure, they have to come all the way from there to Madras Medical College. How long they will suffer? They will be made to wander here and there. Then one broker will come, okay, you go to this private hospital, you will be getting this surgery done in a very fast manner. Because till that surgery, he has to undergo dialysis. Every alternate days he has to undergo dialysis. So it's very tough. So at one point of time, they will decide, okay, I'll sell my property, I will sell. One person, I had only one lorry. That is his whole property. He sold that to undergo this surgery. Like that, see, they have come from Tirunelveli. So that is what they are telling. So spread this, strengthen the public health system. We have wonderful infrastructure, more than 35 government medical colleges. We have enough super specialists. What this government is doing, the super specialists are posted in primary health center where they can't do anything. There is no operation theatre. The super specialists are posted in small taluk hospitals where there is no operation theatre. This is what is going on now. Even every postgraduate of doctor after doing MCH DM, they have to do 2 years bond. They are posted in a place where there is no operation theatre. That is it. On contrary, patients are made to wander from Tirunelveli, Nagarkovil, Kanyakumari, Madurai, this Namakkal to Chennai. Why? That's what we are telling. So you have doctors, you have a facility, expand this transplantation methods to other districts also. And then compared to other state, we are better. We are doing good service, and then we are giving even for the recipient, they have to get immunosuppressive drugs for lifelong. It's very costly drugs. That is also we are providing. But do it in a proper manner so that these kind of rackets are not there. So the government should have a holistic approach in grabbing these kind of racket. Who is giving? Why he is giving? Okay. Solve his economical problem, give job opportunity, strengthen the MSMEs, because of this electrical current, the fees increases, tariff increases, fare increases, so they are closing. There are so many issues. So concentrate on the people who are donating, why they are donating, why they are selling. Concentrate on the areas, Namakkal, this place, that place, Erode, Tirupur, there is an industrial area. So there is a severe crisis. You have to see this issue in that angle also. It's not only this racket is coming, somebody is getting 5 lakh and somebody is getting 1 lakh. It's not only why they are giving. Now it has come to limelight. It was there long later. How many people might have given? So it may continue also if such kind of very lazy inspection mechanism, regulatory mechanisms are there. So you have to find out the root cause. You know the root cause is unemployment, poverty, this price rise. So you have to concentrate on that, especially give some measures, give monthly money like universal basic income, or strengthen the industries. At the same time, you give this dialysis mechanism throughout Tamil Nadu. Even the dialysis, do you know one thing? The permanent dialysis technician in Tamil Nadu government hospitals are in single digit. Permanent dialysis technician. We have so many dialysis centers, but all those dialysis technicians are paid very less. And previously they were paid 20, suddenly 20,000 per month. Suddenly the salary has been reduced to 10,800.
So that's the situation.
Situation.
So now we say that we have a robust mechanism. We have a transplant authority here.
We have a
There is a
act.
procedure.
We have
an act. We have an act. We have an authority. There are certain procedures that are there in place that cannot be violated.
Yeah.
But the violation happens in other forms.
Yeah, using the loopholes in the system.
Using the loopholes.
That
in the
also we
system.
can correct it. No.
Now, how do we correct it? Like, that's the question. Now you're saying like we have to focus on areas like Namakkal, Erode, Tirupur, where such cases are being reported. Now, this is the first time in many years that we have seen a case coming up in Namakkal. So, what should the government do? Because the government now says that they are carrying out an investigation. They are looking into this matter very seriously. The health minister has issued a warning saying if hospitals or doctors are involved in this, they will be severely punished. But is this a solution?
All these are welcoming move, but the government should take preventive steps. See, non-communicable diseases department is there in Tamil Nadu, unlike other state. Okay, it is doing good job, but even there is a lot of lacuna in that non-communicable disease department. Why we are bothered means whose kidney is getting affected? The person who is having diabetes for a long time, hypertension for a long time. So losing an organ, allowing a kidney to fail, that should be prevented by giving proper awareness and giving treatment to diabetes and hypertension by strengthening the public health system is one. Another one, the donor, identify the areas and give them economical rehabilitation, and that is the one thing. Third thing is strengthen the public health system, provide these kind of dialysis mechanism and this kind of transplant mechanism in the government hospital. See to that the private hospital role in this is very less. In this government, in this democracy, we cannot say that a private hospital don't do this. No need also. Let the private hospital also be there. Corporate hospital is also there. For the poor people, they can have a government hospitals where the transplant surgeries are done in a more manner. See, that is what I'm very much importantly I'm telling one point, that this government is not utilizing the doctors properly. They are not paid properly. They are in the system, but they are in a wrong place. How they will do surgery?
Okay. Now you say that
approach this in a holistic manner. Try to take the preventive steps in a logical manner.
Okay, in this case, especially the Namakkal case, 6 donors have been identified. 6 people, affected people have been identified, out of which at least 5 documents are fake.
Yeah. So that's what I'm telling. See, this Aadhaar, no? Any number of Aadhaar can be, so many false documents can be easily prevented. What the government said when they brought Aadhaar? Aadhaar is for everything. It's like God.
Aadhaar is safe.
Aadhaar is very safe. Nobody can tamper this, that and all. Now the election commission itself is not believing Aadhaar, and they can create so many Aadhaar. They are telling OTP will come, this, that, and there is some fingerprints. Nothing. Now you see, out of 6, 5 fake documents means it is almost 85%. 85% fake documents can be created. This can happen without the knowledge of doctors, because doctors will see this is the patient, that is the patient. The patient receives the person, this is the recipient, and this is the person is donor. That's all. And the technical aspect, tissue mapping, that is blood group mapping, HLA typing, all these things they will do. They cannot do this, they cannot, and they will not.
They cannot investigate and check whether the veracity of the document.
That is not their job, because that is being done separately by the regulatory authority, and the hospital should provide a person for that, hospital employees for that, to provide such document, and that document should be verified by the authority. The authority should do their job. The act is there. Checking mechanism is there, but that's not implemented properly, and there are so many loopholes. That's what I'm telling. I can give you 10 Aadhaar card like this. Like one person is telling me, one agent, ma'am, I can give you 10 Aadhaar card to you. When I went there to change my address, it's very easy, like that.
So now there is an investigation that is going on.
Yeah.
Are the medical authorities, the health department authorities equipped enough to investigate these cases? How do we prove? How do we punish those people who are responsible for this? Like you said, in the case of Erode, the hospital was was asked to close down for 10 days.
Yeah.
That's all. That's
Yeah,
the
that's all.
maximum punishment
Yeah.
that any hospital will, get from
That is also now only. You know, the IVF technology is there since decades. But when the act came, it's only last year. That is 2021, 22, like that only. When the act came, the parliament, 2 act came. First, the Surrogacy Act came. Next is Assisted Reproductive Technology Act came. After that, after 1 year only rules were formed. So when there was the act was not there, then act came slowly, then the rules were not there. So whatever they want to do, they were doing. Throughout the country it was there. In Gujarat there is one village with the baby industry, IVF. Only surrogate mother will be there, one village. And then the doctor, she is presenting, being I'm a gynecologist, the doctor is presenting that in a very proud manner that this is our village where we have so many things. She is presenting in a conference. That means because there is no act. Now only the act has come, the rules have been formed. But so many loopholes are there. And that's what the government should think, that the government is responsible for the health requirement of the citizens of this country. Here the GDP is, what is a GDP? It's only 1.5, 1.6 even after 75 years of independence. And so we don't allocate money to strengthen the public health system. We give everything in the private. So in private, anything can happen. Even though there are some paperwork, this is the rules. And the rules have been manipulated. One rule simply, I will say, that consent you should get informed consent from the patient. So what is information? So you have to explain that you are giving this one organ, this, that, I am giving it intentionally, I will willingly, without any force, bias, this, that and all. Simply they will get the signature. That's all. Paperwork will be done. But where is the heart? Who is responsible for these kidneys of these poor people? Anybody can do anything with the kidneys of the poor people, who are majority in our country. Even our Prime Minister is telling that 80 crore people are getting this much of 5 kg, the cereals, and then dal, ration, rice, wheat, 5 kg. He is very happily announcing. For 80 crore people. So that many poor people are there in our country, and those health nobody bothers, and those kidneys also nobody bothers. And simply it is, they are not telling any, they are not selling in voluntarily. They are forced to sell. They are left with no other option. Otherwise they have to commit suicide. If you say that, they will commit suicide. And that's also happening. Every day farmers are committing suicide throughout the country. So many industrial people, and in Tamil Nadu is the place where you have family suicides. They don't want to leave their children at the mercy of their relatives or the society. They think that when I am suffering, when I am made to suffer like this, I don't want my children to suffer. They will kill their children first, then only they will commit suicide. You can see the statistics, the family committing suicide is more in Tamil Nadu. And like that, the organ donation is lowest in India compared to the world. And we have to say this, in Brazilian there is one billionaire, his name is Mr. Count. One day he announced the whole world that I am going to bury my car. So he just dig the big hole, and the car, very costly car was brought. Then everybody saying, what, you are a fool, you are just burying this much costly car into this. Then he said, when you people are burying the most valuable organ into the soil without donating, what is wrong in me burying my car? So a car is 1 crore, but your organs are valueless. So that was a propaganda advertisement for organ donation. So there are few countries where the organ donation after death, that is cadaver transplant, is a must. It is by default. Only if I say that I don't want my organ to be harvested, then it will not be done. There are few countries. So government should think of that, increasing the availability of the organs also. And the technology has increased so much. Now there is a 3D printer, artificial pancreas, artificial kidney, artificial blood, everything is coming. So we have to see those angle also. Instead of just identifying only human donors, we have to think of the artificial 3D printers and all these things also. The technology is developing. We have to do research on that.
Right, ma'am. Thank you so much for talking to us and explaining to our viewers about what exactly is happening in Tamil Nadu. Particularly, this case is very disturbing because here, those who are suffering, those who are affected, are the poor people who have been promised heavy, huge money but at the end of the day, they have been cheated.
So in organ recipient also, rich people will get easily. Poor patients will not get, and that is why we are telling to strengthen the public health system, because rich people are getting organ from the poor donor. And
even foreigners are getting organs.
yeah,
from India.
foreigners are getting here. Here in India, the Indians, rich patients are getting kidneys or any organ from the poor donors. But what about the poor patients? That is why they are committing suicide. They are just left like that. And that is why we are telling to strengthen the system to help both the donors and also to the beneficiaries, the recipients. So that the whole thing should be seen in a holistic manner by increasing the fund for health in GDP and to strengthening the public health system, and to see that everything in the runs through the public health system mostly. Here everything is being done in the private system, and that is why the checking mechanism is being done, the bribery is there, all these things are going on. The corruption is seeing to that all these malpractices can happen.
Right, ma'am. Thank you so much for talking. Thank you.